One of the really big advances in medicine, and this is a consensus of all the people who have studied this, is minimally invasive surgery. So when I started as a intern, minimally invasive surgery was just becoming something that was a reality. In the 1980s, it was really just sort of a fantasy, but through the 90s and certainly the last 2 decades, it has become a reality and is one of the most important advances because we know that not only in many instances do you make a smaller incision, but the operations themselves are intrinsically better in some circumstances. So we at UCSF were one of the first groups in the world, and in many instances, the first group in the world to add minimally invasive surgery into our armamentarium of how we treat children. Now, the difficult part of that is when you're the innovators is how do you do things in a reasonable way? That is, you know that what you did previously worked pretty well, but you know also that you can do things a little bit better. But in order to prove that is a challenge. So our motto here is that we really need to embrace technology because we know technology helps. Having new devices, newer ways to do surgery is incredibly important. But we have to do it in a judicious manner. We have to make sure that we've studied this in animals. We have to make sure that we've thought this out. And then we have to make sure that we study it. Everything that we do, we study, we report in peer-reviewed journals, which are our way of sort of telling the world what we did, but also their way of vetting it through our colleagues who look at our studies very carefully. So it's the most important thing because what we're talking about is improving ways that we take care of our children. And there is obviously nothing more important than that.